Today we are talking about clinical notes in dentistry. Recording clinical notes is very important. Clinical notes records the clinical information of the treatment along with the details of the patient and possible variation of the standard procedure. This is key to track back the procedure in the future and also to audit the quality of the service provided. But why is it so difficult to write clinical notes? So first thing, let's try to write clinical notes with an old desktop application. This application has been built with the technology of the 90s, and what you can do at the time was you can select do an extraction of upper right 6 and write the clinical notes. Clinical notes were mainly text-based. Yeah, you can write. You need to write your all the details manual here. Some of the software offer a template, a text template, so you can select one and the text is populated here. But still, you need to write and do loads of changes. This application is commonly used in UK. And obviously it is very difficult to write clinical notes this way. So what the dentist did to overcome this problem is they started to use templates coming from Word or other tools. Yeah. So what you can do is you can select your notes here, you can copy, and you can paste it here. And now you need to change it. So Dr. John Smith and nurse 1 present in surgery, blah blah blah, consent given verbal, tooth extracted upper right 6, reason for extraction or restorative due to caries. Let's take out the other options here. Medical history checked, no changes. Treatment, local anesthetic. Let's select the first option. Infiltration, batch number BN1234 expires on 07/2024. Blah, blah, blah. You can finish you can save it as a text. You can see that it takes a long time to write a clinical note this way. This is one of the reasons why probably dentists they don't do that. So there are tools nowadays that where you can write similar type of notes by clicking. So as John Smith is here, nurse 1, patient consent given verbal, extraction upper right 6, no restorable due to carie, medical history check, no change. First option on the local anesthetic, batch number BN1234, expires on 07/2024, and you can fill the rest of the form here. Now you can save it, and then you are able to come over here and copy, and then paste it in the clinical note. Well, you can see that you can save time this way because you don't have to type, and you just click and then the text is generated, text is copied over and pasted into this old application. Yeah. Now let's see. So when you do this, when you click this button, what you do is you start to write a clinical notes. This clinical notes lives under context of this treatment. Yeah, you're writing the clinical notes for an extraction of upper right 6 that is under treatment plan. There's for a specific patient, and we also know that the doctor is the lockdown person. So you can see that the clinical notes knows loads of stuff about the treatment and the patient. That is the context of the clinical note. Now How to use this? For instance, in Club for Dentist, Club for Ortho, we can write templates, clinical notes to use the context of the patient and the treatment. So, for instance, if you write here, doctor full name and staff list here, yeah, you will start to use the context. So this will turn, when you write a clinical note, it will be the logged on doctor. Yeah. Then patient consent given, you can say these are the two options. Yeah. Tooth extracted, you can use this macro, and the value will be the tooth number that is where the treatment is performed. Yeah. So automatically the system will populate this. Yeah. Again, not restorable, and this is a list of options. Yeah. Medical history checked, no change or updated. This is a list of options. Again, local anesthetics is a list of options. Even another list of options. Here you can write, you can, instead of you can ask for batch number, and here you can ask for expiration date. And again, yes, no is an option, and then you can carry on doing this for all the possible options in the template. Now, if you copy this template and paste it into the note template in Club for Dentist or Club for Ortho, what you will get is a clinical note that can interact with the data of the patient. Yeah. So let's go to the chart, and then let's do an extraction of upper right 6. Yeah, and then you can write the clinical note here. Yeah. So the note here knows who's the doctor because it's the logged on doctor here, and we have a list of people, the member of staff that is defined on the system. So we can select nurse 1, patient given verbally. Again, this is the two to be extracted is upper right 6 because the notes is related to the extraction. No restorable to caries, but can be any other option. Check no changes. Yeah, first option for the local anesthetic, given buccally, batch number BN1234. You can write this. Expires on 07/2024. Yeah, you can write this, and you can select the rest of options underneath here. Yeah, so you can see that some of the information that are part of the treatment plan are already in the clinical notes. The other tools cannot do that. If it's coming from Word or any external tools, they don't know anything about the treatment, so they cannot do. You need to select the site and the treatment, everything manually. But let's push it a bit more. So let's say when you save this, when you've done the clinical notes and then you save it, for instance, you have discharged a patient, for instance, and this is not active anymore. The treatment plan is not active. So what you need to do on an old software is, okay, let's move it to this patient has discharged. Yeah, and you need to do manually. Yeah, while in our in Club for Ortho and Club for Dentist notes, what we can do is we can link the data that has been selected from inside the clinical notes, can then populate the data in the database. Yeah. So for instance, in this case is since this is a post-treatment note and the extraction is completed, when you save it, you can move the patient into discharge. Now, currently the patient is active, but when you save it, the patient is going to discharge. So you can see that the clinical note, the integrated clinical notes, is not just taking the data from the treatment plan or the patient or the current doctor, is also pushing the data into other fields in the patient record. Yeah, This is fully configurable. The clinical notes can be fully configurable, the options can be fully configurable, also the triggers and what you want to change based on the selection is completely configurable. So you can see that is the integrated clinical notes are much superior compared to any type of other notes. Thank you.